Hello to all of our loyal Facebook followers and everyone at AONE 2018 annual meeting in Indianapolis. I'm Mike Mullane, Senior Digital Marketing Specialist at AONE. Today I'm happy to be joined by Heather O'Sullivan, Chief Clinical Officer at Navi Health, a Cardinal Health company, and AONE President-elect Mary Beth Kingston. Our discussion today will focus on the important topic of care transitions and the shift to value-based care. Cardinal Health is a global integrated healthcare service and products company in over 85% of U.S. hospitals that provides customized solutions for hospitals, health systems, and other healthcare providers worldwide. The company is focused on addressing and improving clinical workflows, patient safety and satisfaction, and clinician safety and well-being. In addition to the products and logistics solutions for which you may know them best. Heather and Mary Beth, would you please tell us about your clinical backgrounds and your current roles?
Sure. I'm a geriatric nurse practitioner, and my life's passion is post-acute care, and my current role is as the Chief Clinical Officer for Navi Health.
Hi, and I am currently the President-elect of AONE, and greetings from Indianapolis. We're very excited about that. My current role in my work life is as the Chief Nursing Officer for Advocate Aurora Health. And in that role, I am responsible for nursing practice throughout that integrated healthcare system. Had about 35 years plus experience in nursing leadership and a number of other roles. And again, very happy to be here with everyone today.
Well, thank you. We encourage our Facebook followers and viewers to submit comments and questions throughout the chat and discussion. And like AONE and Cardinal Health, our Inspire Facebook pages. Our Inspire is a Facebook page dedicated to inspiring and recognizing the nursing community, and AONE is pleased to join with them on social media. We'll start with our first question to Mary Beth and Heather. Why do care transitions matter so much in our value-based world?
Well, I'll start. I think, care transitions have always mattered, but they're so important right now. And part of that has been driven by reimbursement. And reimbursement and a number of the changes in the way we're paid has really allowed most of us as providers and clinicians to focus on our outcomes. Not that we have not focused on outcomes for years, but in this way we're paid based on outcomes. So there are penalties and rewards for achieving positive outcomes and also for reducing cost. But I think taking all that aside, the purpose, what we focus on when we focus on value is quality, service, excellence particularly, outcomes, as well as cost reduction. And if we don't pay attention to care transitions, we are not going to meet any of those metrics, and we're not really going to be providing the care that we want to provide to those that we serve. So, for example, not paying attention to what happens during the care transition can result in increased readmissions, as we all know. And a lot of that can be attributed to things like medication reconciliation, patients not taking the appropriate medications, not even filling their prescriptions. And so how do we, as healthcare providers, impact that? Quality of care. So if individuals don't have the appropriate follow-up, if they don't know enough about what they need to do as a patient, as a family member, they can have increased infections, increased falls, and the quality outcomes are not where they need to be. And the service piece is so important. We speak to families across the country and patients who say, I kind of felt that I was left on my own after I either left the hospital or after a procedure. And that service, that obligation to really help people traverse those transitions and have what they need, it's quality outcomes, but it's also their experience. And we want that to be a positive one. So care transitions in a value-based environment is essential.
So picking up on a few pieces that you mentioned, specifically around cost. So as many of us know, the healthcare industry spends over $100 billion on post-acute spend annually, which is quite a bit. Additionally, 43% of the Medicare recipients utilize PAC, or what we call post-acute care, after their initial hospitalization. And then, again, where there's an opportunity, I believe, is 73% of the variance in the Medicare spending is really related to that PAC or post-acute setting. So there's a tremendous amount to use those dollars, I think, more responsibly, and to blur the lines between the acute setting and the post-acute setting to make sure that we have much stronger handoffs.
Perfect. On to our second question. What challenges are providers facing as they work to coordinate effective care transitions across the continuum?
If I had to pick one thing, it would be communication with a capital C. And, I think part of it is just that the way we've been structured, and I'm talking globally, all healthcare, has not been that we have focused on communication across the continuum. We have focused on what happens in the hospital, what happens in ambulatory, what happens in post-acute care. That is changing. And the majority of healthcare systems now are looking at their structures so that they're building care coordination and communication across their system. Not every healthcare provider is part of a system, though, and you need to build that in. So one of the major barriers is, at times, the communication of our electronic health records. I was sitting down with our Patient Family Advisory Council once, and I asked them, what is it that frustrates you as you're receiving care in regards to care coordination? And what they said was that the fact that their information does not translate to all healthcare providers, that they would assume that people would know what had happened, and that is not always the case. So most organizations now are looking at not just how our electronic health records speak to each other, but how we speak to each other and communicate needs and risks of patients. So that's one barrier. The other thing is that we're creating a lot of roles to fill these gaps. And they're wonderful roles, and many times nurses are filling those roles, which is a great role for a nurse. But if we have that same approach with every single person, then we're not going to, the cost of that can be exorbitant. And so one barrier, and I think, again, one thing that really is a focus lately is how do we tailor our care coordination? How do we tailor this communication and this approach to each individual? And some of that is based on who is at highest risk and what your needs are. And then I would say another barrier is paying attention to behavioral health issues as well as the social determinants of health. So much of what happens to our patients is related to what's happening in their living environment, not necessarily their contact with the healthcare system. So, if someone can't get to an appointment, they don't have transportation, or they have childcare issues, or they don't have a home. I mean, you could go on. We need to know that because we need to help to determine how we're going to address that. And then, as I mentioned, behavioral health care, and if we're not addressing that issue, that has so much to do with how much someone can be involved in their own care. And that's a huge piece in terms of care coordination and transitions. Heather, do you have anything to add?
Sure. So another piece that I think that we as clinicians are challenged with is honestly the lack of standardized workflows, processes, and tools. So oftentimes we're still using phone and fax, which are very antiquated. So that would be one barrier we need to resolve. And I think, historically we've talked about warm handoffs, whether that's to an IRF, an LTAC, a home health agency. We now need to focus more on a firm handshake. And I think that that's going to be critical going forward in the value-based care world.
I would also add, and I know you've been involved in this, Heather, that developing a network, particularly if you're in a healthcare system or if you don't have long-term care or skilled facilities as part of your healthcare system, developing a network of people that you work with and have a relationship with and can focus on what is the quality of care, how do we support each other is really, really an important piece too.
Right.
Yeah.
Perfect. On to our third question. What does successful care transition look like, and how have you seen providers tackling these challenges?
Well, I'll start again, but I think the most important, if we say what does a successful care transition look like, it's one where the clinical outcomes are met, the cost is as appropriate as it can be, and our patients and families have had a great experience. So that's the outcome of successful transitions. But what are some of the components that go into that? As we mentioned, communication, a very strong communication piece, I think, is key. Many organizations, such as the one where I work, we're using a longitudinal plan of care so that you can identify what the patient's needs are from the different points in the care continuum. I think that's important. The provider networks that we talked about, and as Heather just mentioned, the use of tools that identify what each person needs. So who's high risk? And then you can tailor your approach to that. But also who is maybe not high risk, but who has significant social needs. So being able to identify that, work on it in whatever setting, but let's say typically in an inpatient setting, and be able to translate that across the continuum. When we can do that, that is a successful, comprehensive approach to care transitions. And also just the follow-up, the contact points in the approach, ensuring that appointments are made, ensuring that there are touch points to check in with people is another component that I have seen.
Heather?
Sure. I think as clinicians, historically, and we're moving away from this, which I'm very pleased to be a part of, is that there's been quite a dependence on the healthcare system for when individuals enter the acute care system for their acute exacerbations of their chronic comorbidities. We need to do a better job working with the families and the patients themselves, not only on their acute exacerbation of illness, but working on anticipatory guidance. And what are those triggers that may send someone with congestive heart failure back to the hospital that might not be related specifically to their medications or their behavioral choices, but more so, as you mentioned, Mary Beth, some of the social determinants.
Yeah.
So I think that's going to be very important for us going forward.
And we are doing, I think, in healthcare, some fairly innovative things with telemonitoring and helping people to identify when they hit those triggers and what needs to be done. So engaging, that to me is one that I probably should have said right up front, engaging patients and families, not just engaging them in their care, but having them drive a lot of that care and looking at their goals. That piece is essential to any type of care coordination and transition management program.
So we're here at AONE 2018. We just had our opening ceremony. What are you looking forward to the rest of the weekend?
Whenever you get a group of nurses together, it is really, it's so much fun to see the sharing of ideas. So, and a lot of it occurs in the sessions, and a lot of it occurs in the exhibit hall, and a lot of it occurs just as people are meeting each other in the hallway. So learning from each other is one thing. And then I will just say that I have a particular interest in behavioral health, and I am super excited to hear Patrick Kennedy speak tonight on a personal note, because I think he's done so much to reduce the stigma of mental illness in our country.
But like Mary Beth, the networking is just unbelievable, and building those new relationships and having others of similar mind to have these conversations with is just absolutely terrific. Not to mention that the enthusiasm and the vibe that we've experienced just from this morning already, you can tell by our faces, we're lit up, and I hope to carry that for the next couple of days.
Very energetic opening ceremony with the greatest showman, Bob Dent. So thank you, Heather and Mary Beth, for being here tonight and providing insights on the care transitions topic. We're looking forward to the great rest of the meeting. Remember to like AONE's Facebook page and Cardinal Health, our Inspire Facebook page. Thanks to everyone who joined us, and don't forget to tag us with hashtag AONE 2018.
Thank you for having us.
Yeah, but I don't think everybody is. Not all of us.